Our guest today is a lifelong Chicagoan who has devoted his entire professional career to Chicago's world-class children's hospital. Our guest today's first role at the hospital was as an intern in the planning department in 1977 while he was earning his master's degree in urban planning at UIC. After serving in many roles along the way and learning the intricacies of how a hospital works, he was named president and CEO of the then Children's Memorial Hospital in 1997. Our guest today has served as president and CEO ever since. Ladies and gentlemen, Pat Magoon. Patrick?
Thank you, Jay, and thank you for the opportunity to be here with you this afternoon. Before I start my formal remarks, we've got a brief video that we'd like to share with you about our institution.
The Ann and Robert H. Lurie Children's Hospital of Chicago will be a symbol of hope for all children.
This great endeavor would not at all be possible without the great support of our community leaders and the community at large.
I'd like to thank all of you for taking time out of your busy schedules to be here today to allow me a few moments to tell you a little bit about an institution, as Jay noted, that I've had the privilege to serve for 35 years, one that I care deeply about, and I know everyone here in the room does as well, and that's the Ann and Robert H. Lurie Children's Hospital of Chicago. This institution, Lurie Children's, is often the last stop on the journey parents make in search of hope for their sick or their injured child. And I'd venture to say that almost everyone in this room, either personally or through friendship, knows someone who's had some experience with our institution over the years. And while we've got a great deal of wind in our sails based on the development of this wonderful facility, I also need to share with you that there are some pretty significant headwinds that face us and those that we have the privilege to serve. Those storms come in the form of federal budget cuts to the Medicaid program, which is, as you may know, the principal insurer of sick and injured children in our nation. And I'd also like to share with you initiatives that we're undertaking at our institution to adapt to the changing times and to overcome those threats. And lastly, I need to ask you for your help. I need you as individual business leaders, as family members, as civic leaders, to really bring your voices together, because children can't vote. And it's through your advocacy that we can work together to protect institutions like ours, and most importantly, those children that we have the privilege to serve. Now, our opening video provided an overview of our history, our mission, and the critically important role that Lurie Children's plays in the lives of those children that we're privileged to serve. Our physicians, our clinical staff, our volunteers, and our board leadership are honored to have been able to transition what was Children's Memorial Hospital to the campus of our Feinberg School of Medicine partners in the Streeterville community. Our hospital is now positioned to do the important work to improve the fragile life and health of the most important population, and that's the city of Chicago's children, the next generation of children. Now, many of you watched on television as that literal transition took place on June 9th. In partnership with the City of Chicago and the emergency medical personnel, we safely moved our precious cargo, 127 individual children, to our new hospital in less than 10 hours. It was a wonderful logistical feat, and I got to tell you that the city was great, our staff were phenomenal, and our families were great partners. It was an amazing operation, dependent on the collaboration of everyone in this city. Well, because of the media attention on Move Day, many were given a glimpse into the life of Lurie Children's. But we also learned that a lot of people, quite frankly, didn't know very much about Children's Memorial, now Lurie Children's Hospital, or what's going on since we were founded in 1882. And they didn't know, for example, that Lurie Children's is ranked 9th in the country by U.S. News of the World Report among children's hospitals nationwide. That we serve and are privileged to serve children from every county, sometimes we call it legislative district, in the state of Illinois, from every state in the country, and from 33 countries around the globe. That our research facility on the Halsted Street houses over 200 researchers who are focused on the identification and the prevention of the causes of disease in children. And more importantly, they're focusing on the precursors of adult disease in children. A number of folks didn't know that we've got 5,000 dedicated clinical staff that treat more than 148,000 individual children in 9 locations throughout the Chicago metropolitan area. Or that we partner with the Feinberg School of Medicine to train the next generation of physicians. Each year we train 92 pediatricians and over 100 fellows, providing for the next generation of clinical leadership in our community. Many people didn't know that the Lurie Children's Child Health Data Lab, which advises policymakers about how to improve child health well-being, has prompted the creation of several important community-based intervention programs in partnership with the government and community leaders. One of those very important programs is the Consortium to Lower Obesity in Chicago's Children, or CLOC. Founded in 2002, CLOC has built a vital, broad-based network of thousands of organizations and other participants to address the important concern of obesity in our children. CLOC has become a national model and is honored to partner with the Chicago Department of Public Health to implement this component of the mayor's Healthy Chicago agenda. Well, building on that success of CLOC, Lurie Children's launched an important anti-violence initiative called Strengthening Chicago's Youth, or SCI. And we can think of no other greater issue to tackle this day than the threat of injury and violence to our children. You see it every day on the news. It is a major concern. And through SCI, our experts are bringing together literally hundreds of organizations committed to work together to prevent violence. Our new state-of-the-art hospital will ensure that Chicago continues to be seen as a center for transformative initiatives impacting pediatric health care not only in our city, but literally around the globe. Truly, all of Chicago embraced that vision when they partnered with us to build the Lurie Children's Hospital. And a hospital like that is only possible in a city like Chicago. This is not only the city that works, but it's the city that works together to improve the quality of life for those that live here. We were benefiting, and the children have benefited, from more than 250,000 corporations and individuals who made significant contributions in support of our institution. So did the 23 cultural institutions and organizations around the city, both big and small, who donated their time and talent to create the innovative interiors of Lurie Children's. Well, these new spaces are designed to both delight as well as to distract patients before, during, and after medical procedures that are often challenging and, quite frankly, sometimes frightening. Some of these standout institutions include the Shedd Aquarium, the Chicago Symphony Orchestra, the National Museum of Mexican Art, and After School Matters. We received important support from the federal and the state government. We benefited from the input of literally hundreds of our employees and physicians, and critically important guidance from our Kids Advisory Board as well as our Parents Advisory Board. We were supported by a team of excellent architects and construction managers, and we were proud to support and surpass, I should say, our voluntary goal of providing at least $100 million in contracting opportunity to women and minority-owned businesses. And last but not least, we owe a very dear debt of gratitude to the over 3,000 construction workers who built this world-class facility on time and under budget. Well, a statistical recounting of our resources and our programs omits the most compelling component of our hospital, the special children who rely on us and our clinical team, both in common, dedicated to their success. At this juncture, I'd like to share with you a few stories with the permission of both these children and their parents, explaining the immediate impact that Lurie Children's Hospital has had on their lives. Jared, as you see here, is a 14-year-old boy who had vascular tumors affecting his brainstem that needed to be removed. As a result, he suffers from complete left side facial paralysis. If left untreated, the muscles that control facial expression will degenerate to the point where they cannot at all be recovered. Fortunately, and quite frankly, thanks in large measure to our new hospital, we were successful in recruiting Dr. Arun Gusain, a world-renowned pediatric plastic surgeon and a leader in facial reanimation surgery. Dr. Gusain came to Lurie Children's and to Chicago because the new hospital offered him an opportunity to create an urban center for pediatric plastic surgery. Dr. Gusain has been working with Jared on a complex set of procedures with the goal of restoring his ability to convey the range of feelings through his facial expressions. Jared is now growing new nerves to replicate the unfeeling ones, which will allow the muscles in his face to work again. He'll be able to smile, cry, and laugh just as he used to. And 6 months ago, this treatment would not have been possible in Chicago for Jared or others. Then there's Timothy, a brave 5-year-old who received a heart transplant at Lurie Children's just 20 days after the new hospital opened. Little Timothy was one of the 127 precious little packages that we took from the Lincoln Park Hospital to Streeterville on our move date, and he became the very first patient to undergo a heart transplant at the new facility. Since Timothy's operation, we've successfully transplanted 48 additional organs in children, including hearts, kidneys, and livers that are now beating, pumping, and sustaining life for these children. now allowing them to move into a future with a chance to reach their full potential. Well, some of these children have needed our heart and lung bypass machines as well, called ECMO, to take over for their heart and their lungs while they're going through their recovery. Now, at the old hospital in the Lincoln Park community, we would generally do about 15 of these procedures each year. This year, since we've moved to Lurie Children's, just this very short period of time, we've cared for already 10 children on ECMO. Just a little note, I know this may be somewhat of a shocking picture for some of you, but it does give you a sense of purpose of who we care for. And I would tell you just a little short story. When I came to Children's, as was mentioned, as a graduate student at the University of Illinois here in Chicago, I was working on a project with a dear friend of mine named Dave Mikas, who went on to be a very successful architect, and we were planning in the old NICU for a replacement in our current facility. So he and I are hurriedly going around, full garb, masked, measuring, looking things, watching our care team in a very crowded space. And there was a patient who unfortunately went into some distress. And as a young kid, watching the care team respond was like magic. And I got hooked. And I couldn't do the good work that they do, but it's not like any other job you're ever privileged to do. I'd also like to share with you a story about 8-year-old Mesfin. Now, Mesfin's parents, they know our hospital only too well because their daughter, Faye, has spina bifida, and our team has been caring for her since birth. But Mesfin made his first visit to our hospital as a patient in August after he woke up complaining of neck pain. Soon afterward, his legs became numb, and he had trouble breathing. When the care team at his local suburban hospital contacted Dr. Leon Epstein at Lurie Children's and then described his condition, Dr. Epstein immediately recognized the seriousness of Mesfin's ailments and the likelihood of permanent paralysis if he weren't immediately treated. When Mesfin arrived at Lurie Children's by helicopter and our team of experts diagnosed and treated him for a destructive neurological condition, things began to turn better. He had had an experience where there was sudden inflammation of the spinal cord caused by the immune system attacking his own body tissue. And Mesfin's parents learned that a full third of these children that are afflicted with this illness, they don't recover at all, and a third barely recover their body function at all. Within 48 hours and under the care of our multidisciplinary team, Mesfin was taking his first steps. After 6 days, he went home and began 3 weeks of intensive physical therapy. And I'm happy to report now that Mesfin, now 9-year-old, has made a full recovery. The busy, resilient, and spunky third grader loves soccer, superheroes, and plays video games with his friends, and is positioned to be a successful adult. Well, Mesfin's story affirms the importance of having a specialized, full-service pediatric hospital with more than 1,100 pediatric specialists in more than 70 specialties here in Chicago. Lurie Children's is the only hospital in the region with a neurocritical care program and a clinical staff trained to handle multiple disciplinary, and it's easier to do than for me to say, conditions like Mesfin has had to deal with. Well, for over 130 years, Children's Memorial, now Lurie Children's, and thanks to a great city like Chicago, has been successful in delivering our brand of care. A promise of compassionate care, specialized care that's well coordinated for children like Jared, Timothy, and Mesfin in an environment that now has no comparison. And we've done it in partnership with the government, with the recognition of the significant role we play in caring for the children of our state. Despite challenging Medicaid reimbursement rates that result in significant losses against our cost, our hospital provides more pediatric Medicaid care to children than any other in the state of Illinois. To give you some context for that, we provide 7 times more pediatric Medicaid care than our partner in this mission, the Stroger Hospital, the preeminent public hospital in our city. Lurie Children's, as you know, is an absolutely vital safety net hospital for children in our city, the county, and indeed the region. Medicaid is an insurance program for millions of low-income children and children with special health care needs. It is the single largest insurer of children in our nation. 1 in 3 children in the country and half of all children in Illinois, half of all of the kids in this state. That's more than 1 million children rely on Medicaid. And although children represent half of all of the Medicaid recipients, they account for just 25% of all of the Medicaid spend. Children and their caregivers face a daunting task because unprecedented budgetary challenges at the federal and state level pose looming threats to the funding and benefits of the Medicaid program. So what does all this mean? Well, it means that delayed payments and draconian cuts in Medicaid funding will disproportionately harm children and those hospitals like ours, not only in Illinois, but across the country, that serve medically complex children. We understand that regardless of who wins the election tomorrow, the financial challenges facing our nation and our state require us to come together to look at ways we can improve the clinical effectiveness of our care, thereby reducing costs and improving the health of our pediatric population. We at Children's and our medical team embrace that challenge. And I want you to know that Lurie Children's and our colleagues at other children's hospitals across the country are asking the federal government to spare children from an across-the-board cut in the Medicaid program, a severe blow. We believe that if we step up and take leadership for managing these children, that we can be a part of the solution to drive down the health care costs. We can help the government bend the cost curve if they allow us to manage these medically complex children. That is, children who have lifelong conditions that dominate their development, such as kids with spina bifida, sickle cell disease, muscular dystrophy, and cystic fibrosis, and cerebral palsy, just to name a few. We know from state Medicaid claims data that 6% of the medically complex patients in the state of Illinois account for 45% of Medicaid spending statewide, which makes it a very important population of children whose care needs to be managed and coordinated so that we make the best use of the financial resources that we have. At the state level, Lurie Children's hopes to partner with the Department of Health Care and Family Services and to take fiscal responsibility to coordinate the care of these medically complex children in Illinois. Lurie Children's has demonstrated that it knows how to do this and how to do it well in a less expensive way. We know this because we have compared state Medicaid claims data to data for our Uptown Clinic for medically fragile children. With aggressive outpatient management, we're able to reduce inpatient admissions, unplanned readmissions, and effectively coordinate care, thereby reducing costs. Our Medicaid reforms are occurring everywhere. They're occurring at the state level and they're occurring at the national level. And we're working closely with the state to ensure children are protected. We were grateful to be defined in statute last spring as one of 19 safety net hospitals that the General Assembly protected from Medicaid rate cuts because of the volume that we provide to the state. At the same time, we need to protect the outstanding individuals who care for these children. Pediatricians and pediatric specialists enter medicine driven by a goal of preventing illness and injury and eradicating pediatric disease, healing, and preventing injuries. Nationwide, there's fierce competition for a limited number of these pediatric specialists. For example, several months ago, one of our pediatric orthopedics, John Grayhack, and I had the opportunity to address a group of individuals, and John reminded those in attendance that there are only 15 people nationwide finishing their pediatric fellowship training in orthopedic surgery. 10 of those individuals were going back to their country of origin, which leaves 5 for the entire country. Those statistics play out over and over again, whether it's in endocrinology, and you contrast that to the epidemic of obesity, or pediatric rheumatology. They're a very rare and dedicated breed. And it's critically important that Medicaid reimburse pediatric specialists, that you know this, at just 34 cents against what it costs them to provide care. So no one can manage a practice as a physician with half of your business in the Medicaid program. We need to protect those pediatricians and pediatric specialists and make certain that their reimbursement is adequate. So on behalf of these talented caregivers and the children that we're privileged to serve, like Jared, Timothy, and Mesvin, I'm here today to really ask for your help. And I've learned from our work at Lurie Children's, to make real progress, you need to have three things. You need to have a big goal, we need to have urgency, and we need committed community leaders. And I think, you know, this was a very successful model for President Kennedy a number of years ago when elected. He said, we as a country need to send a man to the moon. It was a great, bold vision, and it inspired people. It got people moving together, and there were great benefits. We need a similar goal around our children. Today, elected officials, civic and business leaders from across the state are focused on solving the pension crisis in the state and in our local governments. And I'm confident with their focus and hard work and attention that this vexing problem, which affects all of us, will be resolved. But the next big crisis, where there is a need for a great sense of urgency, is the healthcare system for our children. If we must solve the pension crisis so as to not burden future generations, we must solve the child health crisis even more urgently, because it affects our children and our grandchildren in very real and meaningful ways. We must ask, what kind of a society do we want to be? In a small way, that's my job, and it has been for the past 35 years, and I'm asking you to join me and my colleagues in that engagement, to engage in a public debate about what we want for our children, what we want for their health. This shouldn't be a discussion around metrics, where we're worried about a budgetary number and how we fix that number without understanding the implications at the childhood level. When you reduce the number of therapy visits or restrict the number of prescriptions, there's a family on the other end who's impacted by that. There's a cost associated with that if the child needs to be readmitted or if the child needs to go to the emergency room. While critically important that we address the financial challenge, it has to be embraced, surrounded by, and cloaked in what's important for kids. What are our priorities? Children aren't numbers. They're living, breathing little things. And those decisions impact each one of them. And that's where we need your engagement. Across-the-board cuts are draconian and hurt everyone. We need targeted interventions that will have impact not only on the cost, but also on improving health. And we at Lurie Children's don't have the answers, and quite frankly, not even close. But I know that everything we need to do so is right here in the city of Chicago. Our goal is an ambitious one, creating a new vision for children's health care at a time when there is so much competition for resources. The urgency is very clear. Medicaid, the program that is responsible for ensuring a third of our children in this country and half of the children in Illinois, is a grave risk. Now, we've seen firsthand the massive impact that Chicago's leaders can have when they get together and work on a cause. The Ann and Robert H. Lurie Children's Hospital of Chicago is one great example of what a great city can do when people put their shoulder to the wheel, have a goal in mind, and are committed to getting there. So for guys who get to do what I get to do, it's a huge privilege. But it's also good to remind ourselves that it's a huge responsibility that we have to work with our team to secure the resources and to marshal the muscle in the community on behalf of children. So I'd ask that you who are advocates for children, who are business leaders, who are taxpayers and care about efficient, effective care, will get involved, get engaged, and help us protect the children that we have the privilege of serving in Illinois. So please do all that you can as the debate begins around Medicaid, once the pension plan or the pension issues have been resolved, to protect our next generation of leaders, and that's the children of Illinois. So thank you for all that you do in support of our mission and for the opportunity to be with you here today. Thank you, sir.
Well, I'm sure a lot of people want to criticize all that, so yeah, kind of a thing there. Any questions? Miss Brenda, City Club B, will be working her way around. For those of us who visited the hospital, even before it was finished, it's an incredible place, just incredible. Well, Barbara Olson. Where are you, Barbara? Raise your hand. Well, Barbara, you must be, there you are. Well, you made the room. Congratulations. Please describe your important relationship with the Ronald McDonald House and how Lurie children can collaborate with Ronald McDonald House for the benefit of children and their families.
Well, the Ronald McDonald House is a critically essential, important part of the service we provide to the community. When we made the decision to move the institution from the Lincoln Park community to Streeterville, after calling Mayor Daley, one of the first people I called was Doug Porter at Ronald McDonald House to let him know we were making the move, and wanted to set up an opportunity to talk about logistically how we'd move families back and forth, and he said, that's not going to work. He said, we have to come join you. And Doug and his board and the community and the business community stepped up and made a phenomenal investment in a wonderful facility, the largest Ronald McDonald House in the country. And if you've not been there, I would encourage you to get there. It truly is a home away from home for those who need our services. And they are a wonderful partner, not only here in Chicago, but across the country in serving children.
This one, does the Lurie Children's Hospital have a NFP foundation? Does that make sense to you? Okay. Not for profit. Thank you very much, Ms. Wick. For its missions and needs, if so, is it realistic or at risk?
I'm not quite sure what question is being asked. I don't know who asked the question. A couple of points. Children's is a not-for-profit 501c3 organization, and it is very important because it allows us to secure support from the community through our foundation to provide resources for those very important services that don't get paid for by third-party payers. So when you think about our huge translation team, no one pays you to have a translating staff on site to care for a family who doesn't speak English. Nobody pays for a protective service team for children who are victims of abuse or violence. So philanthropy is an important, critical element.
River awards are coming in. Okay. Got that, Jack? Yeah, got it. This is from Ed Cooper, who sounds like he's a neighbor of mine. You know where this is coming from. As critical as it is, how do you plan to use the helipads, the helicopter landing, in less than optimal weather?
That's a simple one. We don't. Just a little note that most people don't know. They're always worried about helicopter pilots being, independent jockeys, and they're all great people, but no helicopter pilot ever knows the reason for his mission. They make the flight decision on weather alone.
As a resident very near it, I don't understand why some of my neighbors are all upset. I mean, they must never have had children. So there you take care of that one. How about a round of applause for our speaker? Very good, Mr.